My name is Marcus Gardiner and I'm a software developer at Softwire. I'm really excited to be here at the RSM today, hearing a fantastic different array of speakers. I think I'm as excited to actually listen to the other speakers, such as Rob Stevenson that we had this morning. By day I'm a programmer, so I spend my days writing code for different clients at Softwire, such as for the moment I'm working on Anthony Nolan, and I've worked for other clients such as the BBC. Today I was here talking about digital solutions for mental health care with a workplace context. I have a lived experience of anxiety and I was using that information in terms of that lived experience and I work as a software developer to do a research fellowship that was funded by the Winston Churchill Memorial Trust and Mental Health Foundation. I travelled to Boston, New York, San Francisco and across the UK speaking to a broad range of different experts in the field, from founders of these digital mental health startup companies to academics and clinicians that were researching this space, as well as different mental health bodies, such as at New York City Thrive, Harvard Medical School, Cambridge University, Silver Cloud Health, Spring Health, and overall it was over 40 different global thought leaders in this space. The research for me had a couple of really interesting conclusions. The first is that mental health in the workplace is a really quantified problem. We know that there's statistics on it. There is a £40 billion cost to workplaces, 90% of people don't share when they experience a mental health concern, and 300,000 people per year lose their jobs as a result of unmanaged mental health conditions. So given that we have that mandate, it's really important to consider the drivers behind that and how digital mental health care has research that proves it can be part of a solution. In practice then, I started to investigate the market and learn that this was a really resounding and massive market of different mental health care solutions. And that the best answer for me wasn't going to be to write lines of code, but to understand the market and help translate it for different people to understand the space and to bring these on from a workplace perspective. What's really important when we look at these digital mental health care solutions is understanding how we responsibly adopt them and how we effectively implement them. As workplaces, we're really starting our digital mental health care maturity journey. And of course, we need to start with preventative digital resources, things like the Mental Health at Work Gateway that helps you navigate different mental health care resources depending on organisation size and other factors. We need to start with that. But we also need to provide impact factors too. Things such as screening and detection that has a regular cadence and that's digitally delivered. And having that flow onto digital care delivery forms that are available to our staff. By having that one integrated journey for mental health for our employees and aiming for those important mental health outcomes, that is how we provide a solution that really helps people understand the mental health conditions they have, avoids the trap of them having to look at an internet that is a wild west of different digital mental health care resources. And that's how we provide practical solutions that people can use on the devices they're already spending so much of their time on. The psychological field knows that there are not enough fully qualified clinical therapists to manage the full breadth of mental health need. So it's not a question of whether digital mental health care has a role, only a question of what role digital mental health care should take. So a really important aspect of that is understanding the market that exists, how we categorize these solutions, how we responsibly procure them from a workplace context, and how we so importantly effectively implement them. And that's what I was covering on my talk today, and there's a more detailed report that exists online with the Winston Churchill Memorial Trust that goes into depth on these different areas and findings from my research.